Yeah, I want to know, like, this is for like after we graduate, like, how did you guys choose if you want to work with children or adults?
I can tell you.
Good question.
I found working with children much more difficult than working with adults. So I had a child. I used to sing to the children to keep them entertained. It was boring because we did a lot of sputum clearance, and that worked for most children. And then I remember a child. She must have been about 11, and I was singing doing this, and she laughed at me and said I was a horrible singer. And I remember reflecting on it and thinking, yeah, I guess my singing does impose. It does impose. Like, she didn't want it, but then I thought, I wonder what life you've had that is your response. You know, that this aggressive, negative response. And I just thought about the horrible, you know, how she must have been treated in her life for that to be her way of working with people, of dealing with the situation. So that was my major patch of time when I worked in paediatrics, and I didn't get a very good rating from my senior when I left that area. And it was a very complicated area, and we hadn't done, so they were plastering neonates and, you know, really young babies, and I had turned a baby over with another nurse, and the drip had come out of this, you know, this premature baby. And I'd done the best that I could do, but the drip came out, so clearly I wasn't careful enough. I was doing the very best that I could do with my skills. But because I wasn't successful, and I didn't get a good rating, and then I never went to another paediatric hospital, that was mixed paediatric hospital, that's how it happened for me. I never went back to peds. And I could have gone back to peds, but I wasn't exceptionally attracted to it, because there was a lot of, it was considered a very high level job to do neuropeds. So a lot of time in other areas before you could do it. It was just difficult to get into. It was very difficult to get into.
I trained in a hospital in London, and the paediatric ward was it was sort of like the smallest ward, and I probably got exposed to it was mostly babies with sort of pneumonia and stuff like that, and these poor little things. I felt like my hands were too big to do anything to these tiny little things, and I felt totally uncoordinated. But the therapists who work, I admired, because they seem to have a gift. So when you're an undergraduate, you don't always know what branch or specialisation you're going to go into. All the way through my training, I was going to be the best orthopaedic physio. I was going to do sports orthopaedics. I excelled at all that stuff, fabulous. And then I went off and I did a bit of neuro, and then I thought, oh, no one tells me what to do with neuro patients. Like, I don't need, the orthopaedic surgeon dictated pretty much what I had to do. Like, he would say, okay, total hip, you can only do this, they do this on this day, they do that, you do these exercises, you mobilise, blah, blah, blah. You know, crutches, sticks, blah. So it was all sort of laid out, and I thought, wonderful, you know, that was great. And then I went to neuro, and this really good neuro senior physio was saying to me, because I still didn't know, I was just newly qualified, and I got the neuro rotation, and I thought, excuse me, cut that out. I thought I wanted orthopaedics, you know, but we all have to do our rotation, so I went to neuro, and the senior said, right, this is your assessment, blah, blah, blah. I'll take you do the first one. And she assessed the patient just like a doctor would, not like I'd learned as an undergraduate. And I thought, oh, that looks quite clever. And then she says, right, we're going to do this, you need to get the patient up, you need to get them walking. And I'm saying, so how do you do that? And it was really a case of applying some of the skills, because we didn't do BOMA, we did PNF, which was proprioneuroceptive facilitation. It was a new sort of strategy that you could use on a lot of different types of patients, and I'd only ever used it on orthopaedic patients. She says, well, do what you need to do. And I said, but where do I do this? And it was me having to think about what to do, how to do it, and how to progress the patient. because on the ward round, the doctors would say, "Where's the physio?" And, you know, "I'm here." And he'd say, "How's the patient going? Are they getting better? What are they doing? Are they walking yet?" He wasn't telling me what to do. He was leaving it up to me. And that made me think, I've got to decide what to do with this patient. I have to. And so to me, I then went to a hospital in London that specialised in neurology, and I thought, yeah, this is good. I like this. And then I went to another hospital, and I was told, "Oh, we need a senior in the outpatient clinic." I said, "As long as there's neuro outpatients, I don't mind." She says, "Oh, there will be some," but I was dealing with a lot of other patients as well. And then suddenly I was told part of my job was to attend the orthopaedic clinic for all the little babies born with sort of like little club feet. And I had to tape and strap these little feet. And I felt like saying, "I can't do this." I've tried once before and my hands are too big. And there's this big orthopaedic surgeon with hands like bananas, sausages, right? And he's got this tiny little foot, and he says, "I'll show you how to do it." He did it, and his looked perfect, and mine looked a mess. I said, "I don't do peds." Well, so he just said, "That's all right, don't worry." Yeah, he was very good. But it was like a lot of things, I needed practice to do it. I wasn't skilled at it. But, you know, what you end up doing isn't always what you think you're going to be doing when you become a new graduate. My advice to all new graduates is get out there, spend the first couple of years doing everything you can, and then you'll find what your passion is. It's what your passion is, because it's your passion that goes on and on. And from that, because I was never the brightest student. I was not a great, academic by any means. I was very average student. I failed one of my exams, failed the one I should have passed, but I failed it. Had to resit my exams again and then get through. And then what did I do? I end up doing a master's degree here at Curtin University, getting tightly, got my specialisation. So you don't have to be the biggest, brightest academic in the university to do well clinically. You can, and I only did it because pretty much I was passionate about it, and I loved to learn. It's always going on and saying more. I need to learn more. So you never ever stop learning in the health science.